Welcome to the instructional video for the immunizations component of the physician's workflow. All demonstrations are on fictitious patients and therefore are not considered PHI. Today, we will review the overview of the new immunization component, determining if a patient is overdue, in range, or not in range for immunization, viewing historical immunizations, viewing the CDC forecasted immunizations, printing a record to send home with the patient, ordering immunizations, documenting a patient-provided history of immunizations, and documenting an immunization not given for specific reasons. At this time, I am logged in as a physician in the primary care role. You will see here I'm located in the clinic workflow. On the left-hand side are all the components which make up this workflow. Immunizations is located in this list. As with any component in this list, you can drag and drop and resequence into an order that makes sense for your work. For the ease of this demonstration, we are going to add immunization due for this patient. So he has an immunization due on this patient. Now I'm going to move into the immunization component. For the immunizations, on the upper right-hand corner, you have a plus sign. In here, you can order immunizations directly from the component. You can document historical immunizations. You can chart an immunization that is not given and cease forecasting. We'll get into that a little bit later. Here is a filter setting that shows you that you are looking at all visits, not just this encounter. And then we have a refresh button. This refresh button is designed that if a nurse immunizes your patient while they're on the way back to you, you have the ability to refresh and get the most up-to-date information as they walk through the door. Moving on, we have View Forecast. Let's go ahead and click into there right now. View Forecast will open up this M page, which will show you today in bright yellow/orange. To the left is everything that is historical. To the right is everything that is forecasted. If it is a part of a series, such as the 10-shot series required for tetanus immunizations, you'll see what they have a dose due at age 41 years, the dose 4. Again, this is based upon the CDC schedule. You can click this and it will link you to the CDC's website so you can print off a forecast for the patient to take home. We do not have the capability in MHS Genesis to print off this page for the patient. If you want to print a copy of their immunization record, you can click this link here or click back on the immunization print record button. We'll cover that in a minute. Also down here from this page, you can document history and you can chart not given. Let's go back to the main M page and show you what that looks like. So we currently see that we have influenza due, adenovirus, cholera, Japanese encephalitis, and rabies are in range for immunization. We have the ability up here. Let's go ahead and order that immunization for that rabies. So we'll scroll down to where we'll find rabies. You'll notice here I hit close and it's signed in my box. I can also, I want to chart the influenza was actually given at CVS. So we're going to go in here, we're going to go down to influenza, and we're going to mark that the patient does not remember exactly when they got it, but they think it was in October of 2018, and they reported to us what it was at CVS. And submit. You'll see that our page refreshes, and now immunization for influenza is not required. So now we're going to look and say that the adenovirus is not required. So we will chart not given, and we're going to go to adenovirus, select, and we have 3 different types. We have contraindicated, refused, or unnecessary. Contraindicated, you can select either one of these, cancel series and stop forecasting. It will no longer forecast for this patient. And here's a reason why. If they have a permanent allergy to it, you can select it. If it's contraindicated, you can select it here. If they have a positive titer, you can select that as well. You can select a date that you'd like to reschedule it to and why you are rescheduling it. For example, current fever. So we're going to reschedule it for next month on the 24th. Current fever, and submit. Now it's currently contraindicated and it has been rescheduled. Once we've wrapped this all up, we can go ahead and sign that order. You will notice that the order is here. It's associated with this diagnosis, and hit sign. Because I'm not a privileged provider at this facility, it will require a provider signature. Because this patient had no weight entered, and this is a weight-based dosing, we can go ahead and enter the kilograms and apply dose. Here we will have documentation required. Again, this is a test patient with no height, no weight, and no dose ring checking available. As long as your data entry is conducted at intake, this should not be of issue to you. Now you see that it's signed, and we are ready to administer the immunization. Once you would complete through all of your other workflows, you can write your note, and after it's been administered, when you produce your note, immunizations will now come across. For any issues with this change, please log a GSE remedy ticket. Ensure immunizations component is in the summary. We will then focus on those tickets to make the requested improvements. Thank you.